Hello, welcome to my channel. Today's review is on early mobilization for patients with venous thrombolism, which is a review of a clinical effectiveness and guidelines done by the Canadian Agency for Drugs and Technologies in Health. This was proposed in 2018. Stay with me as we go through. Let's start by refreshing our knowledge on what DVT is. Now, venous thrombolism is the formation of blood clot in a vein, which affects adults of all ages and ethnicities. Now, clots occurring in a deep vein are called the deep vein thrombosis, and those occurring in the heart, the lung, circulation system is called pulmonary embolism. This definition was given by Hillegas et al. 2016 and Thompson 2018. Now we are going to talk about the risk factors. Risk factors for VTE are generally divided into inherited and acquired, and patients often have more than one risk factor. This investigation was unveiled by Blue 2018. Historically, patients with acute DVT were restricted to bed rest to prevent dislodging a clot and causing PE. However, immobility now is considered a proposed risk factor for VTE, as it can promote stasis in the blood flow and has a secondary complication such as muscle atrophy and weakness. This was according to Blue 2018 and Christakor 2018. More recent studies suggest that early ambulation and compression stockings are treatment of choice when it comes to acute VTE. This was according to Andor 2016. In this research, they address two basic questions. The first one is, what is the clinical effectiveness of early mobilization for patients following venous thrombolism? Let's move to the second question. What are the evidence-based guidelines regarding early mobilization for patients following venous thrombolism? Let's go back and quickly address these questions. Question number one was, what is the clinical effectiveness of early mobilization for patients following venous thrombolism? Now, in this research, they unveiled a lot of things that I want to share with you, and I believe that after this chapter, you're really going to appreciate some of these things. For the primary endpoint in patients with DVT, the meta-analysis results favored early mobilization over bed rest. Now, early mobilization was not associated with any incidence of PE or progression of DVT than bed rest. What are the evidence-based guidelines regarding early mobilization for patients following venous thrombolism? Both the American College of Clinical Pharmacy, that is the ACCP, and the American Physiotherapy Association guidelines recommended early ambulation for patients with DVT. This was according to Hillegas et al. 2016 and Koran et al. 2012. The ACCP guidelines were for prescribers, and they recommend early ambulation over initial bed rest. The guidelines suggest deferring ambulation in patients with severe pain and edema and using compression stockings in this patient. The authors described this as a weak recommendation based on low quality evidence, as it was based on two meta-analyses from 4 studies, and therefore there is high risk of bias and imprecision. This was according to Koran et al. 2012. The American Physiotherapy Association has a guidelines which is directed towards the physiotherapist. For patients with lower extremity DVT who are at therapeutic levels of anticoagulation, the guidelines recommend that physiotherapists can initiate mobilization of the patient. The authors assess this as a strong recommendation based on high quality evidence. The guidelines also recommend mobilization in lower extremity patient, that is with DVT, after inferior vena cava filter placement. The latter part was described as a best practice point based on expert opinion and therefore has a lower grade of evidence. This was also according to Hillegas et al. 2016. The above evidence is very strong, which implies that based on these things, the physiotherapist can now proceed with treatment when therapeutic threshold of anticoagulant have been reached. Thank you very much for watching this video. This is Michael. Kindly subscribe and share this video.